now the prostate, an organ we all forget about as men until we turn 50. Well, prostate cancer awareness is in September, and this is the month of September, and I'm going to talk to you a little bit about prostate cancer awareness. So, men are 1 in 8 are going to be diagnosed with prostate cancer. It's the number one cause of cancer in men is prostate cancer. And American Urological Association guidelines recommendation for screening for prostate cancer begins at 40 to 45 for men that are Black or in the high-risk category, such as having BRCA1, BRCA2 gene mutations. Right, between the ages of 45 and 50, you can start screening people regularly for prostate cancer if they meet those criteria. Also, men between the ages of 50 and 70 can get every 1 to 2 years PSA screens for prostate cancer, which is a blood draw associated with a rectal exam finger swipe. Beyond the age of 70, it's recommended shared decision-making between the physician and the patient about how old they are, how sick they are, et cetera, and if the prostate cancer, because it's a slow cancer, would it affect them or would they even want it checked? Now, you don't just look at PSA as a number, right? Because the number one cause for an elevation of PSA is enlarged prostate. The number 2 cause is prostatitis. The number 3 cause is prostate cancer. So the first 2 reasons of elevation of PSA in general is not even cancerous. It's important to note that you can look at PSA and you can look at PSA density, which is taking the PSA and dividing it by the volume of the prostate. And you want that number to be less than 0.15. If it's more, you probably need a biopsy. You can also look at velocity, like how much it's rising, right? Prostatitis will go up and down, where prostate cancer will be a steady trend upwards that's steep, with growth of the prostate being a slow growth upwards. So use the PSA plus the velocity plus the density to kind of get the picture together, because prostate-specific antigen or PSA blood screens is sensitive to something's happening in the prostate, but not specific. So talk to your friends, talk to your loved ones, talk to your father, grandfather, talk to your brothers, and educate men in general about prostate cancer and prostate cancer awareness. This is Dr. Hakky with another Dick Talk.